Hi, everybody. My name is Dr. Jaweria Naqi. I am your mentor for this speaking module of OET. I really hope you guys are doing well. So let's start today's session. I would please appreciate if everyone put their mics on mute and unmute it if they want to speak something. Okay, so let's start this session. This is the topic for today's session is importance of feedback and empathy in OET speaking. Before moving on to the session, I would just like to elaborate a little bit about the OET exam. So what happens in this exam is there's two ways you can give this exam, either virtual or in person. You're provided with an interlocutor who's your examiner, who acts to be a patient. They're all actors and they act really, really well. What you have to do is you have to present a scenario in front of them. You would be given 3 minutes for reading, and that would be followed by 5 minutes of presentation. After that, there would be no gap between the two of your presentations. Immediately, the interlocutor would show you the next role play card, and then you would follow the same scenario all over again. You would be given 3 minutes for reading, followed by 5 minutes of presentation of the scenario. So in total, you're provided with 20 minutes for, 7 minutes for each of the cases. So yeah, it's a pretty basic exam. It's complicated in a way that it's extremely, they're not testing your medical knowledge in this exam. It's more about your skills of speaking English. So that's why it's a little technical. There are some tips and tricks that you need to follow to pass this exam. And if you do that, then definitely you're going to ace it. Moving on to the webinar. Okay, so feedback and empathy is extremely important when you're taking the OET speaking module. So there's a separate clause in the interlocutor list which says sympathy or empathy. That means the interlocutor would mark you if you have shown any sort of sympathy to the interlocutor during the scenario. So it's extremely important. So like it says, it's important to take feedback. It's important component in marking criteria. It helps to ensure that the patient is understanding the communication. Like things like, are you following me? Are you getting me? Do you understand what I'm saying? So speech of that sort is extremely important when you're giving a presentation. So you have to add these sentences in the middle of the role play card presentation. And then, I'm sorry to hear this. I'm so sorry it happened to you. All sort of sympathy you could show to the patient. Make sure you do that because the interlocutor marks very strictly for sympathy, showing sympathy. Okay, so, all right, when we're talking about feedback, you're supposed to check whether the patient is able to grasp the information that you're giving them, right? Like for instance, you tell them about diabetes and then you ask them, do you understand what I'm saying? Or do you have any idea about what diabetes is? So stuff like that would help them think that, okay, the doctor is an active listener and he or she's trying to help you gain knowledge about the disease. A few examples of feedback sentences would be, is that clear? Am I clear so far? How does that sound? Do you think you can do that? Do you feel comfortable about my advice? Any questions? So all of these sentences. Now we talk about empathy. So when we talk about empathy, you have to make sure the patient you understand the patient's pain and the condition the patient's going through. So just for a quick second, imagine yourself in the patient's shoes and then think from their perspective. For instance, if you're giving them a bad news, they have been diagnosed with a cancer and you're about to break this news to them. So make sure you're extremely, extremely, extremely sweet. You're extremely polite. Don't be rude. Just show them extreme empathy. Think from their perspective. Think about what would be going on in their head. Okay, so I'm really sorry to hear that. It must be really painful. Okay, so the last sentence, I appreciate your fears, worries, concern, condition. I am not personally a fan of this sentence. If any one of you like to use it, they could, but in the New English, we obsolete this sentence. We don't use it anymore. This is an old slide, so it's still there, but I wouldn't use it because you do not appreciate fears or worries or concerns. You can use other sentences like, I know what you must be going through. I know it must be painful, stressful. These are more polite sentences in today's um, era, not this one. Okay, so what are the examples of empathy? I can totally understand your concern. I know what you're going through. If I were you, I would have felt the same. This is my favorite line to say. Because it helps you connect to the patient on a very deep term. I'm so sorry. I know what you're coming from. Okay, so moving on, reassurance. Reassurance is very important when you're going through a scenario. Just at some point in the middle of talking to the interlocutor, make sure you reassure them by saying that something that, this disease is self-limiting or don't worry about it. Um, there's nothing to get alarmed about. Uh, Stuff like that. Just make sure you reassure the patient and then get along with the presentation. In the end, before we start the role play cards, does anyone have any questions about the webinar or about any general question regarding the exam criteria? No questions at all? Okay, so if you guys have any questions, please speak up and ask the questions before. Okay, so how to end the conversation? Someone asked. Um, so we end the conversation by saying, yeah. So we end the conversation by saying that, okay, so have a speedy recovery. Here's my card. You can keep it and let me know. Call me if you have any questions or queries. If the patient has been diagnosed with a disease such as asthma, COPD, diabetes, something that he hasn't been diagnosed with before, and this is the first time he's been diagnosed with, you usually give out pamphlets and brochures and leaflets in the end and say that here's a leaflet about the disease that you have been diagnosed with. Please make sure you go through it for gaining more knowledge about it. Um, just adding these little particular sentences would get you more marks in front of the interlocutor, you know. So the conclusion has to be really, really good. That's what I always tell my students. The intro has to be really, really good. Um, there's specific marks for intro and conclusion. Make sure you finish it in 5 minutes because the interlocutor would not mark you if you finish later on. Um, I mean, you still do get marked, but then if you don't do the conclusion, and if you like, for instance, you're still speaking, so what they do is they interrupt you in the middle. They say, doctor, your time's over. And after that, you cannot speak. So make sure you are done with the conclusion when the interlocutor tells you that your time's over. It leaves a very good impression. It tells the interlocutor that you have finished the scenario and they mark you accordingly. Okay, so how much time it takes for OET preparation? Shanzi has asked this question. You guys can also speak up and ask. You guys don't have to type. You guys can speak up. It's okay. Like we're in the speaking module, so it's better if you guys speak up. So it depends from person to person, I guess. Some people do it in a week. Some people they take 10 to 15 days. Some people I've heard they study for months and months. So it just depends on how good you are with the language and how well you are with the techniques. It's better if you join a program like, for instance, this med exam expert they provide with like excellent classes because like when you know that you have to take a class, you have paid for it, there's a mentor, then you definitely, a part of your brain ticks and it tells you to definitely study better. All right, so can you tell me how to improve my listening? Because I already attempted 3 times and it's always listening. I got 330, 340. Um, Listening, do
Yeah,
a lot of practice.
I want to ask a question.
Yeah, sure. Just give me 1 second. Let me
Yeah,
just, is that you?
yeah, hello.
Yeah.
Yeah, I want to ask regarding during the role play, in the mid of role play, if we lost, then we can recover efficiently.
So if you're lost, like if you're just zoned out, or if you're like don't know what to speak anymore, that's what you're asking?
Yeah, if we don't know
Mm,
what to speak or how to take further the role play, or if we mess anything happen, like if we became nervous or anxious, so then how to reconcile uh, ourselves.
just say that, like, so it depends on the person how they do it. If I'm lost or if I'm blank or zoned out for a moment, I would pick up from where I leave it. Okay, so I'll be like, I would ask for a quick second from the interlocutor, and then I would be like, okay, so as I was talking about diabetes, it causes this. If you're lost and if you don't know what to say anymore, use your medical knowledge. All of you guys are from the medical profession, right? So the least you guys could do is throw your medical knowledge at the interlocutor, which you shouldn't do technically because it's an English exam, but just in case, if you're lost, if you don't know what to say, if you know, firstly, there's no way you could be lost. The role play card is in front of you. There's things written on the role play card that you're supposed to say. So it's like it's going to stay in front of you the whole time. So there's no way you guys can get lost. But even if you do, make sure you read the role play card, make sure you pick it up from there. And if not, then just throw your medical knowledge. Just speak about what you know, what you have in mind. Okay? That's one trick to go through it. Okay, so someone asked me that they attempted 3 times and it's how to improve listening. So I think just practice would make it better. A lot of practice, practice as much as you can because that's the only thing that could enhance your listening skill. Um yeah, I mean there's nothing more that you could do for listening. For speaking too, I always tell everyone to practice with your colleagues, your parents, everyone.
Hello,
Yes.
Hello.
hello.
Yes, I can hear you.
Yes, my name is Jayesh, and I was the one guy that asking about listening.
Mm-hmm.
Actually, when I do in my like with colleagues and in my home, I always get 38, 35, this type of scores. But
Mm-hmm.
whenever I attempted the exam, I always got 340, 330. That's why I'm asking. I'm confident. And after the exam, I think that I going to get 350, 340 easily. But
Mm-hmm.
380, 390 easily. But whenever the result came, I always got 340, 330, and I don't know how it's happening and where I'm doing the mistakes also. So that's why I'm not improving in that listening part because I don't know the cause of the problem, you know.
Yeah, I understand, doctor. So what happens is that sometimes there's something that we're doing wrong and we don't know of, and we think that what are we doing wrong? Like we're doing everything right, but we're not getting the results that we want. So so have you joined any preparation course before this?
No, no, I always do self-study
On your
and
own? Okay.
yes, yes, I got 390 in speaking
Hmm.
and 316 in reading and 310 and 320 in writing. But always I'm getting backlash in listening part. I got 340, 330. It's like it's an borderline.
Mm-hmm.
That's why it's really frustrated me. If it's like 300, 310, it's not
Mm-hmm.
frustrate me that much. But it's always on the borderline,
Yeah,
and
I
it's
understand.
irritating me more.
I understand. So there's something like there's this teeny tiny thing that you're doing wrong, which is causing this problem to occur. So I would suggest that if I were you, I would probably like do it under the light of a mentor so that they could tell me where I'm doing it wrong or what's going on with me. Like, what is that one thing that I'm not able to grasp right? So I would just urge you to join a preparation group so that you could know where you're going wrong. Because see, you probably are not able to self-evaluate what's wrong with you. Maybe someone else could. You know what I'm saying?
Yes,
So just,
yes.
yeah,
Thank
give a
you.
thought to this because that's the only way that you could find out where's that one point that you're making a mistake that you're failing from such a close margin.
Okay, okay. I'll think about it and thank you for your help also.
No problem. Okay, so is it okay? First book the exam and then going through preparation, or first to improve the sub-test, then for booking. If I were you, I would first prepare and then book the exam. But it depends what kind of a person you are. So, okay, let's start with the cases. I think if we do a couple cases, it would be more clear to you guys about how to do a case. Okay.
Ma'am, if I join this course, do you offer one by face-to-face speaking role play or just
Yeah, it is a one-on-one speaking role in the live session, during the live session. Like, so I have a live session once a week. If you want to present a case, if I ask that, okay, so who wants to present? And for instance, you say I do, then me and you are going to have a one-on-one session. But you have to come forward and be like, hey, I want to present the case. Because there are some students who are so laid back that they don't, they pay, they do everything, but they don't participate in the live session. So then it's no use. You're wasting your money if you're not interacting with the mentor, right? So it's a one-on-one and it's pretty cool. At the end of the session, you guys are provided with the assignments to take back home, and those assignments are evaluated and they're graded as well. So it's a whole, it's not like you're only gonna be attended once a week. Okay, so who wants to present the scenario? Is there anyone who wants to volunteer?
Yes, ma'am. Me.
Okay, can I please know your name?
Deep Singh.
All right. So let's start. You would be given 3 minutes for reading. After 3 minutes, I would be interrupting you and telling you that your time's over, and then we will start talking about it. Okay? So you have 3 minutes. It would be great if you grab a pen and paper and jot down points, important points, and your time starts now.
I start reading.
Yes, please start reading. This is exactly how you're gonna present in the final exam. They would give you 3 minutes, you would start reading, and then after 3 minutes, they would stop you, and then you guys would discuss about the case. Okay?
Okay, ma'am. Your patient is a 50-year-old insurance broker.
No. Okay.
Recently.
No. We don't do that. So you're gonna read it by yourself, not to the interlocutor. You know how you prepare for something? This is your preparation time. This is your personal time that I'm sorry.
Ma'am, I'm new here, so I don't know.
Yeah. I understand. That's okay. So this is the time that the interlocutor would give you to prepare for the scenario. Okay, so what you're going to do is you're going to read it quietly and make notes. And then the interlocutor would interrupt you and he would tell you that, hey, your time's over. So now start talking. Then you would start talking, being like, hi, I'm
Okay.
your presenting doctor for today. My name is this. Can I please know your name and age? And then you'd be like, what brings you here? And then you would start presenting with the interlocutor. All right? Okay, so it's you have 3 minutes from now. Read and make notes, and after 3 minutes are over, we will start the case. Okay? All right. Good luck. And doctor, if you could please mute your mic while reading, that would be great.
છોકરી ઓ અહીંયા પૈયા તમાર મગજે માજો ના એને ભણ્યા ભલો ના એમ
All right, doctor, are you ready? So 3 minutes has elapsed. Are you ready for performing the scenario? And if that particular doctor is not ready, then does anyone else want to do it? Because I'm sure every one of you read it. So does anyone else want to come forward and perform?
May I try?
Sure. Go ahead, please.
Right. Good afternoon. My name is Dr. Mullen. I'm one of the doctors in clinic. May I just confirm your name and date of birth?
Hi, doctor. My name is Alex and I'm 50 years old.
All right. Nice to meet you, Alex. What brought you here today? How can I help?
So doctor, I just recently went through divorce. It was extremely stressful, and I think I need a holiday to, restore my energy and to improve my spirit. But my boss has refused to give me a vacation leave. So I've come to see you to request a medical certificate that would allow me to have 2 weeks off of work. So can I please obtain that certificate, doctor?
I see. I know that it must be stressful for you, but don't you mind if I ask a couple of questions? Do you feel stressed and depressed more than 2 weeks?
I mean, yeah, it's been a couple weeks that I've been feeling stressed out.
There is thing about certificate. We cannot just give you certificate if you feel upset. There must be severe depression or some real medical condition. Unfortunately, I cannot provide you as you're not showing signs of depression. But I may refer you to psychologist. How does it sound?
Yeah, doctor, I understand that, but stress is an illness, and I'm entitled to take a sick leave. Then why am I not provided with one?
Unfortunately, it's against our medical ethic. I cannot just give you certificates because there is no underlying reason which is suitable for that. So, and it also can have some worse effects on you as well because it's not fair enough. It would be much better if I will refer you to psychologists. He can do assessments if there is the real reason, something about your mental health, then they will give you a certificate. Is it all right?
Yes, doctor, but I just think that a good holiday would help me restore my energy and would help me, feel better about myself. So it was just this only reason that I wanted to go.
I know it must be really stressful and frustrating for you. I'm so sorry for that. But unfortunately, in this case, I won't be able to help because we cannot give you a certificate just for annual holiday leave. Unfortunately, it doesn't work like that.
All right, doctor, I guess.
I know that stress may affect your health and you cannot feel comfortable about it, and work may even make it worse. So probably to see psychologist, it may be a great idea. Would you like to try it?
Sure, doctor. I think I would give it a shot.
Great. I'm so happy to hear it. Do you have any other question you would like to ask me?
No, doctor. Thank you so much.
All right. To sum up, I will refer you to psychologist. We will book appointment for you, and then we will assess you. And probably, if you need sick notes, I will do it. If not, I can provide you with some help, probably some courses. The professional will decide what is better for you. Is it okay?
Yeah.
All right. It was a pleasure to see you. Take care.
All right, doctor. Are you done with the scenario?
Yep. It seems like so.
Okay, good job. This is great for performing. It was your first time performing?
Honestly, yes. I just read through all the steps like I was reading a book, OET preparation, and that's it.
Perfect. Yeah, you did amazing. Good job for that. It's extremely, extremely impressive for the first time doer to do it so perfectly. So good job for that. The conclusion, however, we could just cut it a little short and be like, here's my card, you can keep it. Contact me if you have any problems. I wish you a speedy recovery, stuff like that, after referring them to the psychologist. The intro was really good. You showed empathy, you showed sympathy throughout your scenario. You reassured the patient. So all the elements were there in your presentation, and you finished in time. You finished it in 4 minutes and 30 seconds. So that was great.
Do you believe I will be able to pass this exam, like speaking part,
I'm sorry,
with
can
my
you
current level? Do you
what
believe
about
that?
speaking?
Do you believe that I would be able to pass this exam with my current speaking?
Okay, so I think so. Yes, why not? Just a little more practice, and I'm sure you'd be able to obtain a grade on this particular module. So just a little more practice. For instance, in the beginning, after you did the introduction, you asked for the name and age. The next question we asked the interlocutor is, how would you like to be addressed? And then the interlocutor would say, you can just call me Alex, because there's some people who add a prefix or a suffix before or after their names. Some people just like to go by their nicknames. Some people just like to go. So there is a point in the interlocutor's checklist for this particular question. So make sure you ask the interlocutor this question. So, just these teeny tiny tips and tricks that they're there You just need to follow them, and then I'm sure you'll be able to pass the exam.
Okay, thank you so much.
No problem. Does anyone else want to present a scenario?
Hi, Dr. Tanai.
Sure.
Thank you.
Okay, so you have 3 minutes, and after that, I would be discussing it with you, and your time starts now.
Okay. Doctor, I'm ready if you can start.
Okay. So your 3 minutes, you still have a couple seconds, but let's start if you're ready. Okay.
Hi.
Start please.
Hello. I'm Dr. Munawar, one of the doctors in the medical chair today. Can you confirm your name and age, please?
Hi, my name is Linda and I'm 27 years old.
How are you doing today, Linda?
I'm good. I'm doing good.
Apologies, what do you like me to call you?
You can just call me Linda.
Sure. Please free to call me Munawar, Linda. How can I help you today?
So doctor, what happened was that I had this cut on my upper left thigh from falling on a sharp piece of metal 3 days ago, and I bandaged my leg by myself. At that time, I did not think that it required medical attention. However,
Mhm.
last night the area was very red and swollen, and I was kind of freaked out.
Mhm.
So I
Mhm.
came to you to just make sure that everything's all right.
Mhm. So how about the pain? Is it still paining? Are you okay with the pain?
So last night the pain increased.
Mhm.
And
So from if I give us pain score where 0 is less than 10 maximum, how much do you score your pain from 0 to 10?
I would rate it 8.
8 from responsibility. Do you take any medications for that?
No, doctor, nothing.
Um, so I would be giving you free painkillers at the end of the day. Do you want somebody to come and get you right now?
Sure, doctor.
I'll make sure that one of the nurse comes and give you a painkiller. Is that okay?
Yeah.
So tell me more about it. Is there anything you want to add? Have you ever been taken any other medications apart from the painkillers?
Um, no, doctor. It's just that I've changed the bandage myself 3 times after showering. And there is no specific medication that I took for it. It's just that I had some paracetamol at home, so I popped a tablet or two. That's about it. No prescription medication I was taking. And yeah, that's about it.
Yeah. After talking to her, I do understand that it seems a bit painful and suffering. It is very important for me to examine. Do you mind if I examine your wound and check what exactly is happening in that area? I do have to remove your bandage as well.
Yeah, sure.
Right. Okay. We will be doing this dressing in the presence of chaplain. Would that be okay? We have to go inside. Yeah.
Yeah.
Okay. Thanks. So, shall we discuss more what's happening with you?
Yeah, sure, doctor.
So after being examining your wound, it seems like yes, it has a bit got infected, which does mean that your wound is might be having an infection. For that, will be prescribing a few antibiotics. Am I making sense?
Okay.
Another thing is, can I ask if you have ever taken an immunization injection called tetanus?
So I did have tetanus once as a child.
Yeah.
That's about it. That was the only time.
Right. So after in your case, we are certain things you should be doing, Linda. One is you need a wound dressing because I need to check your wound, remove the debris, and then do a dressing again because it might need a little bit of cleaning, what we call the surgical debridement, which is necessary because we have to remove all the unhealthy tissues so that if there is an infection, it doesn't spread. Second thing I need to prescribe you antibiotics. Thirdly, I
Doctor,
suggest you
I'm
have to
so
take
sorry to
a
interrupt you.
tetanus.
I'm so sorry to interrupt you. Is that background noise coming from your end?
I believe no, not from my end.
Whose mic is on? Can you please turn it off? Please, can you guys turn your mics off? Hasibullah. Dr. Hasibullah, can you please turn your mic off? Dr. Kausar is, I think, presenting the case. Dr.
Yeah, I'm Dr. Munawwar, ma'am, the
Dr.
one who's
Munawwar,
presenting
okay.
the case. Yeah.
All right,
yeah.
thank you. Oh, oopsie.
Yeah. So I'll just brief it out if you want, otherwise we'll run.
That's okay. Okay, all right, go on, please. I'm sorry.
So we know there are 3 things we'll be doing in things. One is I would like to clean your wound and then remove any unhealthy tissues because that would prevent from further increase in the infection. I'll prescribe you a few antibiotics. Thirdly, because your tetanus immunization has been taken a long time ago, I would suggest you have to take another one today or tomorrow. And is there anything else? Do you have any other questions right now from this management?
I just want to ask you, why would I be needing another tetanus injection since I've already had one during my childhood?
Right. Thanks for asking that question, Linda. Usually, immunization of tetanus injection it protects from infection caused by bacteria called tetanus. The effect of the immunization is about 3 to 5 years, and maximum up to 10 because you have taken it in the childhood. Probably the effect must have been gone. Taking this injection again will protect you from the most injurious severe form of infection. So that's the reason we want, because childhood, we don't think that it still persists and it would protect you right now from the probability of having a tetanus infection. And
all right, doctor.
Tetanus infection can be very serious.
Doctor, whenever your time's over, I'm sorry.
Yeah. Yeah.
So the interlocutor would interrupt you in the exact same manner if you run out of time. So I'm sorry I had to do that.
Yeah, thank you.
Okay. So your intro was really, really good, Dr. Whenever you checked all the points on the interlocutor's sheet, It was great. And then what I think was, what do you think where you went wrong and why you ran out of time? What do you think happened wrong?
I think the technique of exam, because this exam needs a proper technique, not just a conversation. So it's important that you know how to do it in terms of technique. I believe that.
Yes, so what happens is that it's a very point-to-point exam, right? We don't beat around the bush. We don't say extra things that, okay, I'll send in the nurse, they'll do your dressing, and do you mind if I take off the bandage because I also have to change your bandage? So we don't do all that. We just say what's written in the role play card, because if you do all these extra commodities, you're going to run out of time. Because with each word that you're speaking, you're running out of time already. So make sure you complete all the tasks first. Okay, there were 5 tasks. Do all the tasks, and then if you want to speak about something extra, about, giving some extra knowledge, go ahead. But without completing the task, if you go ahead and if you just stick to one point and start talking about it, then you're going to run out of time, and your entire presentation would remain, uncompleted, and then you would not be marked well by the interlocutor. When you don't finish the scenario, it leaves a very bad impression on the interlocutor. So make sure you finish. Make sure you cover all the points. You were going right on track. I thought that you would forget to do the examination, but I think in the middle, you finally realize that it's an examination scenario. If you don't do examination in this scenario, you would get a very bad grade. So good job for, I don't know, like something in you probably told you to do examination and you were like, can I examine you? So good job for that. You always take consent and you always examine in this type of scenarios. Apart from that, the bandage part and the nurse coming in and all of that thing was unnecessary. It was not written in the role play card. Just written to what's written in the role, just stick to what's written in the role play card and you would finish it in time. Okay?
Thank you. Yeah. Lovely. Thank you, Dr.
Yeah, you did great though. Okay, so before we end the class, we can do one more scenario. So anyone who wants to do it, please come
I'm
forward.
ready.
Sure.
Yes,
Yes.
I'm ready.
Okay, just give me 1 second, please. Okay. All right. Okay, doctor. So you have 3 minutes for reading. It's a pretty big scenario, so make sure you finish it on time. Make sure you stick to the role play card and get done with all the tasks that are mentioned here. Okay? So you have 3 minutes. This would be our last speaking role play card for today. Good luck. I will let you know when your time's over.
Who's going through? I am, or
I'm sorry?
who's going through? I am, or
Yeah, so this is going to be your case.
okay. Thank you.
The 29-year-old one.
Thank you so much.
No problem. I will let you know when your time's over. You have 3 minutes for reading.
Okay.
Okay. All right, doctor, are you ready?
Yes.
Okay, go on, please.
Hello, my name is Abdurrahman. I'm one of the doctor. Could I check your name and age, please?
Hi, doctor. My name is Alex, and I'm 29 years old.
Oh, thank you. What I should call you?
You can just call me Alex, doctor.
Alex. Thank you so much, Mr. Alex. Nice to meet you. How can I help you today?
So doctor, I went to a restaurant and I had fish, and since then it felt as if, if there's a fish bone caught in my throat, and my throat feels irritated, and no matter how much water I drink, it just don't seem to dislodge. So I'm so irritated, and I came to you finally. Can you please help me, doctor?
Oh, I'm so sorry to hear that. Do you have been at this moment?
Yeah.
Oh, where is it been exactly?
I'm sorry. Can you please repeat that?
Where is the pain exactly, please?
Right in the middle of my throat, doctor.
Okay. Can you please score the pain from 1 to 0? 1 is the pain lowest and 10 is the highest.
Doctor, the pain was around 7. It began during the dinner that I had, and then it just, it's still there. It's not 7 anymore. It had toned down to 4 maybe, but it's still there, and it's the irritation that's bothering me.
Oh, I can understand you. Okay, thank you. Okay, you said the pain is lowing down at this moment. Yes, you have vomited
Yes.
or difficult of swallowing?
Swallowing has been all right. It's just that I'm not eating or drinking anything because I feel uncomfortable.
Oh, Mr. Alex, I think the pain you feel is might be scratched the tube pipe, and it's not the bone.
Okay.
Would you understand? Could you understand my words? If you understand,
I do, doctor, but I understand what you're saying, but I really think that there's a bone stuck there. It has to be.
Okay, if there is bone, you will feel like you will vomit, and you feel difficult of swallowing, and the pain was worse. So now, as your condition is settled down, mostly it could be scratched esophagus, scratched tube pipe. Okay.
Okay.
So.
Okay.
So the irritation and pain you feel it's gone away after a while.
Okay.
And now there is no fear about the bone of the fish. You swallow it. So
but doctor, how could you be so sure that there is no bone?
If the pain worsen or still continue, we'll do an X-ray image to ensure there is no bone. Okay, and also we can do referral from for the gastroenterologist doctor to reassure more. Okay.
Okay.
Could you understand me well?
Yes. Yeah, I think it's clear, doctor.
Okay, thank you so much. I'm going to sum up, if you understand me well, what we have talked about. You come to me today with after swallowing bonefish, and you feel irritated and pain. Pain is going down, and there's no vomit and no difficulty of swallowing. And I told you that it may be scratched tube pipe, and there is no fear. What we can do, we follow up the pain and swallowing condition. If there is increase in pain or difficulty swallowing, we will do an X-ray image, or we can refer you from for the gastroenterologist. Is that okay? Is the sound okay?
Doctor.
Okay, thank you so much. Is there anything you want to ask me?
No, doctor. Thank you. Your time's over, doctor.
Thank you so much.
Thank you. Okay, so great presentation, doctor. I was extremely impressed. It was a bummer because you weren't able to finish it in time because you finished all your tasks. So why didn't you just end it? You didn't have to summarize. You should have just ended it. You should have just said that, okay, here's my card. Let me know if you
Mm.
have any questions. Bye-bye.
Okay, thank you. This is the first time I do presentation,
Yeah,
so I tried only. Okay,
it was
am I am
amazing.
I am I good?
It was a good try. Yes,
Okay.
doctor. I was
Thank
extremely impressed.
thank you so much. Of course, I have finished my Vertibi exam near, so I have done a lot of practice for communication skills on MRCS Vertibi.
Good job. Good job. I'm very, very impressed. I'm proud
Thank
of
you so
you.
much.
Good job. It's just that,
Thank you so much.
okay, one thing, doctor. One thing.
Okay.
So in this particular scenario, there was this one integral thing that was required for you to
Okay.
do, and
Okay.
you skipped that thing. Do you have any idea about what I'm talking?
Okay.
What do you think it was? There was this one thing that you skipped.
I don't have anything really. I don't have an idea.
Doctor, it was examination. You were supposed to
Examination.
examine the patient's
Oh,
throat.
I didn't examine. Okay.
Hmm. And I even asked you that how are you so sure that I don't have a bone in my throat? Remember, I
Mm.
asked you a couple times. So
Okay, according to the examination, I have done. Okay, so you wanted it like that?
yeah, you were supposed to do the examination in the beginning. It's just
Oh,
a
okay.
sentence,
Right.
yeah, that you have to say
Okay.
in front of interlocutor. You don't have to
Mm.
do it's just for the sake of it. You just have to say, hey, can I examine your throat? I would be as gentle as possible. Do I have
Mm.
your consent? And then the interlocutor says, yeah, sure, go ahead. And then you're going to be like, okay, so I just examined, and according to my examination, there's no bone in your throat.
Okay. Okay. That's fine.
Right?
Okay. I will do again. I will do next time, inshallah.
Yes, just make sure in the scenarios in which there is examination written,
Okay.
or yeah, if you already
Even if the task not they did and don't request to examine, if there is a case of need examination, I will ask to examine the patient. Is that right?
in such type of scenarios, yes.
Okay, if the patient if the scenario like this one,
Yeah.
swallowed fishbone. Okay, I have to ask. I'm going to examine you. I will be gentle for you.
Yes.
Okay, thank you so much. I appreciate it a lot.
Thank you for coming forward and examining. I really appreciate the confidence that you have.
Thank you so much.
Good job. So before we end today's webinar and today's live session, does any one of you guys have any questions about the exam that you guys want to clarify or ask? Go away, please. Ask away. Sorry, ask away. Ask the questions if you guys have any questions, please, before we end today's session. All right, so are you guys sure? You guys, please take session for new students starting OET preparation. Yeah, so that's what's gonna happen. Dr. Dilip, that's exactly what's gonna happen. I mean, I don't know what you're trying to say because the February session that's about to start would be for the new students who hasn't done the preparation, who hasn't given OET exam. Even for those who have and who know, they're welcome to join in as well because none of us are perfect and we still need like mentors. So yeah, that is what is exactly going to happen, Dr. Dilip. So you're welcome to join in, and every week there would be a session, either speaking, listening, reading, or writing. And then after that session, you guys would be given assignments, and this would continue for a month. And after a month, I guarantee you guys that you guys would be able to say that, okay, I'm definitely ready to give my exam. The best part about MedExam Expert is they give you an access to their library of free study material, which is an amazing thing. I personally took lessons from MedExam Expert when I was going through my OET 2 years ago, and I studied from them. I passed in my first attempt. So, all right, on which date of February that session will be held? Dr. Dilip, you would need to talk to either Faizan or Ramesh about this. Any of the coordinators would get to you and guide you about that. Definitely. So yeah, because I'm not sure. Thank you. You're welcome. Okay, guys. So with that, the session comes to an end. I would see you guys again if you guys sign up. Definitely, we'll meet again down this journey of OET. If not, even then, I wish you guys good luck. I hope you guys do well. Thank you guys for having me, and good luck for your exam. Okay. Okay, one more question before we go. How much minimum time is required for speaking preparation? Well, okay, I get this question a lot. So I personally took 10 days to give my exam. 10 days for preparation, and after that amount of preparation, I gave my exam. I had joined the OET MedExam Expert group, and after that, for my own like self study, I took 10 days, and then I was able to give the exam. So I think if you guys sign up for this thing, for MedExam Expert, so for the total time is 1 month for them to complete your course. After they're done with it, you guys can take an extra like 5-10 days and get it done with, because after that, you guys really don't need any time. You guys would be so ready to give the exam. So yeah, in total, if you ask me, like 35-40 days would be more than enough. Okay, so you're welcome, no problem. All right, thank you guys. I'll see you guys later for sure if you guys stick around. Good luck for your exam. Thank you.